So what are KPIs? KPIs are key performance indicators, and we should all have some type of indicator to let us know that we're doing well or that we're not. So in the clinic, if we want to talk about an outpatient clinic, what would be our KPIs and how do we create graphs that encourage everyone to monitor their daily performance? So we're going to talk about the check-in to room. We're going to talk about a patient throughput. So if we talk about check-in to room, we should have a board that's displayed somewhere that everyone in the office can see that tells what these KPIs are. Again, this is your process, so your key process indicators should be process indicators for your process. So if we're going to do check-in to room, so we would have a board that was displayed and it would have check-in to room. So then every month, someone will be responsible, the clinic manager will be responsible for coming in. This is month to month. Let's say this was January and let's say this was February. So now we're trending here. So every month, everybody can come in and say, man, last month it took us 15 minutes to room a patient, and this month it's taking us 20. But every month, we can do month over month, and we can trend to see how we're doing and where we're going. Another important thing on your KPIs is that you have some type of goal. So we know that maybe this is where we are, but this is where we're trying to get to. So everybody can understand that we are not where we need to be. And we work on action plans to get us where we need to be. So this is a key process indicator board, or a board that you can have in your area that everybody can see. You don't necessarily want your patients to be able to see this, but you do want all of your staff, you want it to be in a place that's visible to your staff, and it's a constant reminder of where we're trying to be. These are our goals. How do we make these in the blame game? So if we have one set of staff, maybe the nurse is saying, well, it's not my fault that patients are taking too long to be in the clinic. We do our piece. We get room to physician. We get that piece right every time. So you assign these areas to who they belong to. You assign owners. So your check-in person, this is their metric. Every day, this is how they're measuring themselves. This is for your nurses. This is how they're measuring themselves. So then the total visit time, there could be a gap between when the physician leaves the room until we get a patient out the door. So every metric should have an owner, and that owner should be able to speak to maybe there are reasons that the metric went down that month. There's nothing wrong with that, but you need to be able to speak to it. And if you can't speak to it, then if there's not an owner, then nobody's taking responsibility to be able to speak to it or to dig in to figure out what was going on that month. So that's how you use metrics to help end the blame game. You assign an owner and you have them responsible for reporting out and giving you suggestions, because there shouldn't be one person giving all the suggestions on how to improve. The process owner should be doing that. 5, how do we drive continual improvement? Maybe last year was a very bad year for us, and it was taking our patients 75 minutes total time, but our goal was 65. So we've done a lot of process work. We've put some things in place. We've had our nurses give us great feedback on how we can improve this time, and we've driven this down. Now we're down to 65 minutes. We're hitting our goal. It may be time to create new goals. So continual improvement happens when you're constantly surveying where you're at and you're analyzing that information and then moving forward. I think every healthcare organization or everybody takes pride in what they do, and they want to be a center of excellence. So you look at where your goal is, and then you also measure that to other national healthcare facilities that are your same height, same demographic and makeup, and you look for ways to figure out what your benchmark is and where you should be. There's a lot of literature out there on process improvement. There's a lot of literature out there on baselining and goals, and you continue to look for ways to improve and break down these different processes to improve. So for example, again, if we want to talk about room to physician, we may want to break this down to say into a further category and say our patients that need immunizations, how long do they take? Do they take longer? And that's a different project, but that's another opportunity that you have to improve, to figure out exactly where your breakdowns are and what you want to improve. But you use your metrics, you use your data, and you push for your data, and you make sure that everybody is comfortable with the data and they agree and approve and have bought in that these data points are correct. And that's how you use data to help you in your organization.